So Getting to Outstanding is part of a national programme to improve palliative and end-of-life care, and Dorset is one of 7 sites across the country, and within Dorset, Purbeck is one of the participating sites, and we're just really keen to explore how palliative care in the community is working, how people are being well supported at end of life, because we know that if we can get that right, if we can help to support people really well at home, that means they're much more likely to have a good experience of those last days, weeks, months of life. But also it means they're less likely to need to go into hospital or into a care home. So trying to support people really well at home is part of the aim. And really excited to hear more about how the community support workers work in Purbeck. It's quite a unique model, and how the whole team works together to help support people.
I deliver end-of-life care to people that choose to want to die at home, and it's a privilege to be able to have this service in Purbeck. It's about the person on the day and what type of care that they would like to receive, whether that be a full bed bath, hands and face wash, or just to chat sometimes, or just making them a cup of tea. It's just what they want on the day. What matters to me about last years of life are being able to do the things that they want to be able to do if they're able to. And towards the very end is for them to be comfortable, for them to be pain-free, and for them not to be frightened. And obviously that is, a lot of the time, that's combated with medication and things that can help with that. Yeah, I think being frightened for me is the most important, and being, knowing that we are there to help with not just care, with reassurance. I love my job. I can't wait. I'm awake very early in the morning and I can't wait to put this uniform on and go to work.
Personalised care to me is whatever it means to the person I'm looking after. So as part of my role, we would go in and assess a patient and we would get to know them as a person. It's different from ward nursing in the fact that we get to spend more time with people. We get to know them and what matters most to them. So it might not be healing their leg, it might be being able to go out and walk their dog, so it's whatever matters most to that person. Some people just like to talk before they have the nursing care. So, to have a chat about how they're feeling, because we might be the only people they see in a day. So it's a lot about talking as well as providing the nursing care. When it's going well, palliative care is a calm environment. It can look like lots of different things, but someone could be in bed and very settled with their family around them. The medication that they need is all in place. Everybody knows the support that's available and the support is in place. They're not wanting anything. They've got the right equipment for them to be able to remain at home. They're in their own, they might be in a hospital bed or they might be in their own bed. They've got their own duvet. Everything around them is just as it was before.
When I went to look after a patient in their own home who was end of life and then she sadly passed away, I then realized it wasn't that scary, and it's a beautiful thing to look after a patient at their last moment in their life and after they passed away. I think everybody deserves to have a good ending. Yeah, and it's a very rewarding job. For example, the district nurses and all the other teams, the job that they do to look after patient until the end is very rewarding and it's an amazing thing to do.